My name is Carla Finzel. I qualified as a veterinary nurse in 2001, and it appears to be that my district veterinary nursing of the last 3 years is the first of its kind in the UK. So let's talk a little bit about what a district veterinary nurse does. We have human district nurses that treat patients in their home, and district veterinary nurses do the same for animals. Under the direction and instruction of the veterinary surgeon, a district veterinary nurse provides intensive care nursing, specialist clinics, palliative and end-of-life care. We do this in the home for several reasons. Mainly because many pets find it stressful visiting veterinary practices, and is terribly important that they have absolute rest in order to fully recover. We also visit homes to help pet owners that struggle to visit the veterinary practices. This may be due to work commitments, this may be to physical disabilities and mental health. They may be located in remote locations and transport is not regular. Owners love their pets, and we ask too much of them, expecting them to have nursing skills that we as vets and veterinary nurses have taken at least 3 or 5 years to acquire. A district veterinary nurse coaches and mentors pet owners, giving the confidence and empower them to treat their pets in their home.
So this is Mimi. She's my cat of 14 years. I've got 2 cats, one's called Mocha and one's called Mimi, from the same litter. She became gravely ill a couple of months ago and was in hospital for a good 7 days. When she came out, I was just given all this medication. I didn't know what to do. She was stressed, I was stressed, and I just couldn't handle it. And I went to my vets, and she very luckily knew Carla, who then helped me look after her for 2 weeks. It was I couldn't have done it without her. With all this medication, she came twice a day, 8 o'clock in the morning, 8 o'clock in the evening, and she managed to get well because of that, and I don't think she would have done without it. It's just so difficult to pill animals, to give them all this stuff on your own and without any kind of medical training. So thank you, Carla. You can thank Carla because she's still here because of it. I think without Carla, I wouldn't have one of my cats now, without doubt, and 2, I probably wouldn't have my sanity. So I think it's a great service that really, really needs to be looked into because it's helped me as an owner.
Hi, my name's Roz. I'm a veterinary surgeon that works at Busy Hospital in Brighton. We have lots of intensive care patients who we struggle to get home, and we feel they're well enough to get home because they're on multiple medications, sometimes having tube feeding multiple times a day. And people are really busy, and it's a lot to take on when you're not used to that level of care for your own pet at home. But also, apart from helping us with that, the district veterinary nurses such as Carla have been helping with our newly diagnosed diabetic patients. So starting them on their insulin injections, which can be really challenging, and also our hypertensive patients or potentially hypertensive patients that can be checked at home and their blood pressure measurements taken in an environment where they're very calm and comfortable. For me, something which I find particularly useful is when we have clients who are either elderly, disabled, perhaps clients with dementia who really struggle with some of the new treatment regimes we recommend them, but also taking in information when they come to see the vet. So if they have a report that goes to the district veterinary nurse, the district veterinary nurse can go to their house, can assess how they're getting on, show them how to medicate, and just help them with the day-to-day tasks that they've been introduced to by the vet. I think without that, it's really hard to expect them to do what we ask of them, and also it means we've got eyes and ears in the community that can feed back to us on how these new regimes are going.
This year, the District Veterinary Nurse Development Group has been created. A team of volunteer vets, veterinary nurses and human nurses who have come together, moved by the impact of my work since 2015. We as a group want to build on my work together. We know there is an appetite for this. Your support will help us get on the road nationwide to warmly meet these wonderful veterinary nurses and help them start their journey towards becoming that all-important link between the vet, the owner and the pet in our communities. This will be the start, and from there the District Veterinary Nurse role can grow.